Our next speaker is Dr. Janet Stopka, or Stopka?
Stopka.
Stopka. Thank you.
Thank you for this opportunity to tell my story. My name is Dr. Janet Stopka, DDS. I am a practicing dentist from the south side of Chicago. I wholeheartedly support mercury-free dentistry. I became mercury-free and a mercury-safe dentist in 1996 after joining the IAOMT, who assisted me in saving my life. I was able to get rid of all my symptoms. I have not used mercury as a restorative material in 14 years, and my patients are given proper informed consents. No one has ever asked me to place mercury in their mouth. They all understand that it is toxic. Many of them don't even know they have it in their mouth. I learned mercury was toxic in the 2nd grade. I don't let them breathe it in, and if it's removed, I no longer allow myself to breathe it in. I would briefly like to describe my experience with mercury. Mercury is a poison and not an allergen. I had 3 small amalgams in my mouth upon entering dental school, placed when I was 12. My mercury issue started to become a problem when I entered dental school. There were approximately 90 students in my class, and in one of the technique classes for preparing ourselves to work on live patients, 90 students opened capsules of amalgam to scrape out fillings without vacuum suctions and let the scrap fall on the floor. Most of the biohazardous waste sat there until the cleaning crew came in that night. The very next morning, I woke up unable to bend 5 of my fingers. Not a good symptom to have for a prospective dentist. I went to doctors and they found I was perfectly healthy. Nothing was wrong with me. Nothing was found wrong with me. I had blood tests done and even served in the United States Air Force Dental Corps for 3 years. But the military places a lot of mercury fillings. After my residency the first year, I was on the amalgam line for recurrent decay and fractured teeth. Over the course of the next few years, I developed more symptoms despite the doctors telling me that I was perfectly healthy. My symptoms were not only 5 swollen joints, but I was unable to digest food. I could only eat anything but eggs and yogurt. Anything I ate made me feel bulimic. It sat in my stomach like a poison. I could not keep awake, and I would fall asleep during lectures. I even fell asleep during a comedy club in Las Vegas. I had to sleep a minimum of 48 hours over the weekend. During the week, I had to make myself exercise and sweat excessively and then sit in a sauna for an hour because it made me feel better. My head felt like I had cellophane stuffed inside, and my sinuses gave me a pounding headache. I wanted to kill myself. I was depressed. Poor me. I was perfectly healthy. Looking back at my life, there is an old expression that hindsight is 20/20. Listen to what I observed in dental school. My roommate lost part of her hearing. One of the top students in my class was forced to drop out due to development of a hand tremor. A girl had her first seizure on the clinic floor while working on a patient. I heard the scream. Most of the girls made frequent trips to the health clinic for urinary tract infections. Most of the males in my class became alcoholics. One of the amalgam instructors was dying of cancer. There was an old expression, if you remember, that hindsight is 20/20. And we all learned how toxic mercury is in 2nd grade. Why, when you graduate from dental school, is it rendered non-toxic? Fortunate for me, my uncle was a medical doctor and told me there was a problem with mercury. I remembered him saying that while I was in dental school. I was misled and informed by the ADA. Mercury fillings are a 200-year-old mistake of the profession. Because I wanted to become a productive member of society and graduate, I poisoned myself.
Doctor, you have 20 seconds.
I wanted to help others. I wanted to help prevent others from getting ill. I can go on and on about how I detox, but suffice it to say, I can bend my fingers, I have no headaches, and my ears are clear, and I can eat a cow.